New COVID vaccines are expected to be available as soon as this week amid a surge of the disease here in California. So what do you need to know about the vaccines and when should you get them? I spoke today with the Chief Medical Officer for Eisenhower Health, Dr. Alan Williamson.
Dr. Williamson, first off, tell us about the surge we're seeing in COVID cases, why that is, and are we seeing that here in the Coachella Valley?
Yeah, so there's several new subvariants of the the Omicron variant of the COVID virus, and they seem to really surge in the summertime, a little bit unusual. We typically see surges of respiratory diseases, including COVID, during the winter months, fall and winter months. This year, we got a head start on that. In the summer, we had this new variant come out, and a number of people unfortunately became ill from that. The good news is, like most of the other variants we've seen, this is still a very different scenario than what we saw in 2020 when all of this started. Primarily a serious upper respiratory viral infection, targeting the same groups that we worry about with flu and so on. The older patients, those with comorbid conditions, certainly can become seriously ill with this virus as well. But in general, we're not seeing as many hospitalizations, as many patients in the intensive care unit on ventilators and so on, certainly compared to what we were dealing with in the early phases of the pandemic.
So nothing to be alarmed about here in the Coachella Valley especially.
Yeah, we've seen an uptick in the number of hospitalizations. We were running, very low, often 2 or 3 patients in the hospital. I'd say on average now we're probably closer to 8 to 10 patients in the hospital. So an increase in the number, an uptick in the number, but not overwhelming. And again, nothing compared to what we dealt with in 2020.
So tell us about the new vaccines.
So there is a new version of the vaccine coming out, and this is what we should expect really essentially every year. COVID, like all other viruses, are going to continue to mutate and have new subvariants come out and so on. So every year we should expect that there's going to be a new version of the vaccine. So this is really the same technology, same vaccine we're used to in essence, except that it's targeting these specific variants that we are seeing circulating over the course of the late spring and into the summer and so on. It obviously has to be a little bit of a lead time for the manufacturer of these vaccines, so we're always lagging a little bit behind. But fortunately, the vaccine that should be coming out very, very soon, this week or next week, we should start to see first shipments of that vaccine. Seem to be very good about targeting the vast majority of the subvariants that we're seeing today.
When should people get vaccinated, and do you think they should combine that with the flu vaccine?
Yeah, that's a great question. And there is a lot of debate about that. I think there's only a few really clear answers to that. If you have had COVID over the summer, let's say, a number of my friends, for example, have had COVID over the course of the summer, there's very good data to suggest that the immunity from that lasts typically about 3 months or so. The immunity from the vaccine has typically lasted at least 4 to 6 months. So many people are recommending that if you had COVID over the course of the summer, that you wait at least 3 months and then get your vaccination so that you're protected through the entire winter season into the spring. If we're talking about at-risk individuals, our older patients, patients with lung disease and other pre-existing conditions, diabetes and so on, that we know have always put them at greater risk for hospitalization and more serious illness, should be considering getting vaccinated in September to October as we typically start to see that upsurge of the fall viral illnesses. As to the flu vaccine or the RSV vaccine, there's good data out there to suggest it's safe to have COVID with either the flu vaccine or COVID with the RSV vaccine. There's not as much good information yet about whether it's safe to combine all three, but there's certainly good information that it's safe to have a flu shot and the COVID shot at the same time, for example. All right.
All right, Dr. Williamson, as always, we appreciate your time. Thank you so much for joining us.
Thank you, Peter. I appreciate it.